My name is Dr. Paul Ashley and I work at the Eastman where we run two courses. One is a full-time D-Dent in paediatric dentistry and the other is a shorter MSc which is part-time over 3 years. That's a flexible course for dentists who want to try and fit in some studying along with their normal busy working day lives. The big issue really globally is caries in children, and you can see that in this country, in the UK, because caries in children is one of the most common reasons for a child to be admitted to hospital. And really I think our aim is to try and prepare modern dentists for this modern challenge. If we're looking at our doctorate course, we've got a range of modules. We start off with the basics, so we're trying to show dentists how to restore damaged teeth, etc. Then we move on to more complex things, looking at trauma, looking at the interface of orthodontics. We think a little bit about clinical governance. Clearly there's research in there as well. And then near the end we try and bring it all together. We really try and get our students to treat and plan quite complex patients. As well as that, they do some general anaesthetic work, they do work under inhalation sedation, they get exposure to patients being sedated using IV methods, a whole range of stuff. And then we've got the extra clinics they get access to. So for instance, our students spend some time at Great Ormond Street where they see really, really complicated patients that they probably wouldn't get access to anywhere else.
The whole point of this course is that we recognise that for a lot of people they can't give up 3 years of their life to come and do full-time training. So this is designed so that you can be working in practice, it could be in a practice, salaried services, anywhere, and that you can do most of your teaching in your own time, so evenings, weekends, and then you come for these sort of dedicated week blocks. So it's supposed to be designed to be flexible and work around people's busy lives. Most of the sort of didactic teaching we try and do online so that when they come to us they've got most of the teaching already. So we go through all the sort of topics that we do. We start with managing caries in the younger child, then we move on to trauma, then we talk about behaviour management, some more complex types of children, how to manage their behaviour and get the treatment done. And then thinking holistically about the child, thinking about a growing child and how you're going to plan for their development. In the second year, we focus a lot on sort of activities about sort of more medically compromised, more complex types of children and how to manage them. And then in the third year, they do a thesis for their MSc.